Hello everyone, my name is Frame and welcome to Focus Point 360 Advanced Primary Eye Care Roadshow. And today we all know that the early eye detection is very important to prevent some common eye disease that will cause further to your vision loss as well as blindness. And our 360 Advanced Primary Eye Care Screening consists of 8 steps and to check for your overall eye health status, all right? And retina screening is also one of the steps for the ultimate eye screening, and it is also related to our topic later. And we are truly honored and proud to have invited an expert to join us in this afternoon and to enlighten us on this important topic about the importance of regular fundus examination among diabetes patients. And let us welcome Dr. Mohd Rawi, a medical retina and uveitis consultant in KL Eye Specialist Center and ready to share with us today. Hello, doctor.
Hello, hi Frame. Thanks for inviting me. Thanks for Focus Point for inviting me for the talk.
Okay, we are also truly glad that you are here. So can you please slightly introduce yourself to the audience?
Okay, I am Dr. Mohd Rawi, a medical retina and uveitis consultant. What I'm doing is more on patients who have diabetes or any relationship complication from diabetes that lead to vision loss. But the most important thing that I would like to emphasize now is how to prevent vision loss so that we can prevent it rather than treat it, because prevention is always better than cure. Okay. So I think we will go to the slides because that's the most important point that we would like to tell today. Okay.
Okay,
so
cool.
Can we go
only
to
ask
the slide?
Questions when it is necessary.
Yes, it's
all
good
right.
for me to for you to ask me questions.
All right. Okay.
Yeah. Okay. So we go to the slides. So these are the 3 shocking facts about diabetes. Okay. First is diabetic retinopathy is the leading cause of blindness in Malaysia. So it is the second after cataract, but unlike cataract, that is reversible, diabetic retinopathy could be irreversible. So the patient, especially the working age population, age of 50, sometimes at the age of 30, they can have severe vision loss that they couldn't work, they couldn't earn money. So what will happen in their lives? So that's why it is important for us to discuss on how to prevent this from happening. Okay, the second one is diabetes is one of the fastest growing global health emergencies of the 21st century. So the number is getting more day by day. I will show you the facts, the data that we get in the whole country and in our country, in the whole world and in our country as well.
Okay.
So the third one is almost 1 in 2 adults with diabetes are unaware that they have diabetes. So meaning
one of us will get diabetes.
So let us screen.
Yeah.
Okay. All right. So this is a patient who come with type 2 diabetes who never had eye screening.
Oh.
So he came with sudden onset blurring of vision. You can see that from the photo that you have, all these are blood in the eye.
Oh.
So they have floaters. So they can have what they call as sudden onset. Suddenly they couldn't see and they came but this is considered as an advanced stage of diabetic retinopathy. Okay. So this is a normal eye. So you can see the difference, right? There's a blood bleeding in the eye, and you can see the yellowish spots, which is edema. There's a swelling in the eyes.
Oh.
Okay, so basically,
how can they see? Because I don't see any blood vessels here.
You couldn't see because it's obscured by blood.
Oh.
Yeah.
Okay.
Because the eye is like a ball. So when there's a bleeding in the eye, the doctor couldn't see the blood vessels and the patient couldn't see what is happening in the world. Okay. So this, what the patient said is the diagnosis had a huge impact on me, my family and friends. So what happened if, let's say, they come with eye screening? Because when you come for regular eye screening, at least yearly, what will happen is that they will have awareness. They know how to control the diabetes. They know when they have to meet the doctor. So in that sense is that they create awareness. The family members know that they have to control the diabetes, so they will prepare good food, good environment for the patient. So that's why it's good for us to have eye screening once you are diagnosed with diabetes. Okay, know the fact that type 2 diabetes is the most common diabetes, which is 90% of diabetes.
All
We
right.
have a lot of, a few type of diabetes, 90% is type 2 diabetes. Type 2, yes. Okay, so these are the things that we are going to touch today. First is the overview of diabetes. Second one is the pearls, 5 pearls, what you need to know on diabetic retinopathy. What's next? What are the steps to better care after your eye, for you to have a better vision and take home messages? So the overview of diabetes. 1 in 5 adults in Malaysia have diabetes. So out of 5,
Yeah.
Let
Be
us
careful.
check.
Get your eye check done, okay?
all right. Okay, which is about 3.9 million people aged 18 years and above. See, 18 years, not 30 years, it's 18. All right, so we have to get screened, especially if they have symptoms. Okay, and the trend from 2019 to 2019 is getting higher. Okay, when we see the blue line is the one who have been diagnosed with diabetes, but the green one is those who haven't been diagnosed with diabetes. So basically, the one who have not been diagnosed with diabetes, the numbers is almost the same as the one who have been diagnosed with diabetes. So 1 in 2 adults in Malaysia are not aware that they have diabetes, but they do have the changes, the complication in the eyes. Sometimes they come because of vision loss, then only they know that they have diabetes.
Yeah, and it's already inevitable, right?
Yes, yes. So that's why we need to screen early. Okay, how about in the whole world? Okay, we can see that almost 50% increase from the year 2021 to 2045. So it's not a problem in our country, but the whole world. Because of sedentary lifestyle, the food that we have 24/7, food are available, yeah, and then lack of physical activity. So that's why getting the numbers is getting higher. So what do you know that the loss of vision is the most feared complication for patients who have diabetes, compared to other problem like heart problem, kidney problem. They have to go for dialysis every day, 135 or 246, they have to go for dialysis.
Okay.
And then problem with foot or legs, they need to be amputated. So the problem with vision loss, 50% of the patients are aware that this is the most feared complication.
Yeah.
So knowing that, we have to know that what are the things that we can do to prevent or to prevent from getting vision loss at an early age, okay, at the age of 50, the working age population. So these are the 5 pearls in diabetic retinopathy. Okay, first, how do we get diabetic in the eye? First is because of very high blood sugar. When you have high blood sugar, which means in this photo on the right, this is on the left is the normal blood glucose. Those who have diabetes, they have very high sugar in the blood circulation. So what will happen, it will cause damage. As the years goes, it will cause damage to the blood vessel in the retina. Not only in the retina, but the whole body system. So they can have vessel leakage. When the vessel is abnormal, they can have leak. They can cause blockage. All this will lead to diabetic retinopathy changes. They can have macular edema, swelling in the eyes, they couldn't see the center. So what will happen? We have vision for us to see center, for us to see at the periphery, for us to walk. We have vision for us to see colors, for us to see black and white at night. So if, let's say, you have macular edema, what you can, you will experience problem to see near. You couldn't see the colors, you couldn't see the documents that you want to sign. If, let's say, you want to eat, you couldn't see correctly. So that's the problem. So that's why we need to screen early. The earlier the screening is, the better the outcome will be, because we could detect it earlier.
I understand actually why most of the people fear of vision loss. Because if, let's say, you lost your vision, right, you actually cannot, it's a restart of your entire life.
Correct.
Yeah.
Yes.
You cannot even perform your job, your daily job, right?
Yes, correct. Especially those who involve numbers, right? They couldn't see the numbers. So that is the most feared complaint. I couldn't see, doctor. How can you help me?
Yeah.
So, but once you come at an advanced stage, it's not easy for us to treat as well. So that's important for us, for you, and whoever who has diabetes to come early, so that we can screen earlier, so we can detect and get a better treatment.
Lah.
Yes, prevention is always better than cure. So the number 2 pearl is in early stage of diabetic retinopathy, patients are asymptomatic. You can see that on the left side, they have changes, but at this point, they don't complain. They don't know that they have the changes.
Okay.
Unless if we screen. Unless if they go to see the doctor or they go to this to meet the optometrist, you can do the screening at 360 degree. They can do the screening and see any changes. If let's say there's any changes, they will refer you to the respective doctor so we can treat. So this on the right side is considered a severe form of diabetic retinopathy. And you can see the yellowish changes is because of swelling in the eyes. So all these, they are unaware of the retinopathy changes unless if it is advanced.
All right.
Okay, so
Even
what are the
bleeding
symptoms?
like that is considered quite serious already, right?
Yes.
But still asymptomatic, is it?
They might have, but not that much. So sometimes they will just, or they thought it's because of they need glasses, so they come to see the optometrist. Instead, they need to see the doctor.
Okay.
So early stage asymptomatic. All these changes are symptoms are when they have advanced stage. So what are the symptoms? First, they can see gradual or sudden onset blurring of vision. Sudden means if let's say the blood vessel leak, if the blood vessel burst, bleeding in the eyes as the first photo that I showed it to you just now, right? That's the sudden onset blurring of vision. But they can have gradual onset. So the vision loss is gradual, not sudden. The second one is floaters. They can see like black spots or web-like spots in the visual field. And they can see distorted images. As on the right side, you can see the phone. This is normal, but this one on the right side is because the nerve at the center, the macula is affected. So this will cause distortion of images. And then you can have altered color perception. The color will fade. The world is beautiful, but you couldn't see. So what does that mean? You don't like it, right? So the most important thing is for us to screen. So the pulse number 3 is patients are unaware of their retinopathy changes until late stage develops. So all these are late stages. You can see all these changes. You can see beading like sausaging in the eyes. We like sausage, but the eyes can have sausage, but this is not that we like. And then you can have new vessel formation. And then you can have bleeding in the eyes, preretinal hemorrhage. At this point, they will present to us. At the second photo, sometimes they didn't come to see us because they didn't realize. Because it doesn't cause any visual loss. But this is considered an advanced stage already. All right. So hence, screening is necessary to identify the group at risk of vision loss. So screening is most important. So pulse number 4. Diabetic retinopathy could lead to irreversible vision loss. You can see on the left side is macular edema. It's swelling in the eyes. Your center vision, the most important vision of your life. You would like, you want to read documents. You want to study. You want to do your work. You couldn't cook.
It's impossible.
Yeah. And then this is bleeding in the eyes in the second photo, and this one is already scarred. Scar formation means you need to do surgery. And sometimes the outcome won't be great. Okay, the eye is an end organ. Like the brain, the heart, the kidney, the eyes, all these are end organs. So once damaged, it couldn't be replaced. So it's an end organ. End game already. Okay, pulse number 4, the other causes of irreversible vision loss. Just now we talked about retinopathy. You can have glaucoma. You can see the photo on the left is a normal eye. This one, the disc. This one on the left.
Oh, this one?
Yes.
Okay.
And then on the right side is the glaucoma disc. So basically you can see the disc is large compared to normal. So what will happen, they could see, they will, if let's say they present with severe glaucoma, the vision is like tunnel vision. And then if let's say you are a driver, lorry driver, can you see the cars coming?
Yeah, cannot.
Can you see your kids playing at the side?
Cannot.
Well, that is a problem. Is it a danger for you?
Very dangerous.
Yes, it's really dangerous. But the problem is they don't detect it in an early stage. They only realize in a severe stage. So that's why it's important for us to screen. You couldn't see the side, but you don't know.
But we actually can check ourselves, right?
We can check, but there's a proper way for us to check.
Oh, yeah.
Yes.
Do your retinal screening, okay.
Yes. Do a proper screening. Yeah. Okay. Okay, so pulse number 5, the good things. Just now I told you about all the bad things. So what are the good things that you can have? Good control of diabetes will delay the progression of diabetic retinopathy. All right? you know that the duration of diabetes of more than 10 years is a risk factor for diabetic retinopathy. But if you have a good sugar control, you control your hypertension very well, you don't have any problem with the kidney disease, the cholesterol is good control, you quit smoking, you have to know that even second-hand smoker, passive smoker is also a risk for diabetes.
High risk group lah.
Yes, high risk group. So if let's say any of your family members or your friends are smoking, make sure you are aware of them 6 meters away from them.
6 meters.
6 meters apart. All right. Obesity and overweight. It's a disease actually. Obese is not a condition, but it's a disease. Yeah, and then pregnancy is also a risk factor for diabetic retinopathy progression. And the other good things is that good control of comorbid illnesses, all these if let's say you have all this problem, hypertension, high cholesterol, high sugar, but you have good control, you're aware and you have good control, you see the doctor, you get your treatment, you go for exercise, you take care after your diet, and you go for eye screening, all this will reduce the severity of diabetic retinopathy. So you can have a better life in the future. Okay, so healthy lifestyle is highly recommended. So go and go for your exercise. So what else can you do? Okay, once you are diagnosed of diabetes, okay, what else can you do? Control and prevention. BMW Series C. Okay, BMW. First is make sure that you have good control of blood sugar, blood pressure and blood cholesterol. Take care after your diet. Get a good meal, healthy diet. Control your weight, okay? And then stop smoking. Go for exercise, 20 minutes, 3 times a week, okay? Or 1 hour a week, all right? And compliant to the treatment and follow-up, okay? Including the eye screening as well. Okay, so we go to what's next? Steps to better eye care. So once you are diagnosed of diabetes, when are you going to have your eye check? Okay, we know that 90% of type 2 of diabetes are type 2. So once you are diagnosed of diabetes, go for eye checkup. All right? Even for children, they can have diabetes as well. So once they are puberty, or if let's say they reach puberty earlier, they go for eye checkup after 2 to 5 years of diagnosis. All right? And for diabetic patients who are pregnant, before you get pregnant, make sure that you get your eye screened. Okay, and in the first trimester, if you are diagnosed of diabetes, make sure that you have your eye screen. All right, so what are the things that we do when we do the screening? First, we can do the direct ophthalmoscope. The doctor will examine your eyes, and we can have slit lamp. We can have indirect way to examine the eyes, and then the one that you have here is fundus photography. So go and check your eyes. So screening is a test. It's a program, not a test. It's one of the treatment. You can get your eyes test as well.
Actually got take like once in a year.
Oh, good. Yeah, that's good. Okay, so diabetic eye screening is a program to reduce the risk of the disease. You want to make sure that your vision is good for the many years that you can, the most that you can go, right? Because you know that diabetes, if let's say it's not controlled, you can have poor vision. Yeah, so this, in summary, first is screening. Screening for diabetic retinopathy should be done in all patients with diabetes mellitus, all right? The second one is to encourage diabetic patients to have comprehensive dilated eye examination at least a year, every year. If let's say you have normal vision, just go for eye checkup because you never know that you have the changes until it is late. The third one is early detection and timely referral at the earliest opportunity could save from further vision loss. So what does that mean is that you have to screen your eyes. If the doctors or the optometrists didn't detect, so how come you can save the eyes? So get your eyes screened, and so that you can detect early, you can treat early. So the sooner the better. Yeah.
All right.
So I think that's all. Together we can make a difference. Change for a better chance for a better vision. Yeah.
All right. So start having your comprehensive eye screening right now. So if you are interested, you can make an appointment and visit any focus point outlet nearby. All right. And also stay tuned to our social media platforms, our Facebook, IG, TikTok, and Xiaohongshu for more events updates and also our eye health information. So once again, we would like to thank you, Dr. Norai, for such an insightful sharing. So that's all for today. Thank you, everyone.
Thanks.